Thank you. Thank you, Mr. Chairman.
Thank my colleague. Because of the kind relations between our two colleagues, Senator Casey will be next, and he is a sponsor of two of the bipartisan bills and also the champion of ABLE accounts, which is extraordinarily important to folks. And Senator Casey, go ahead.
Mr. Chairman, thanks very much. I want to thank our witnesses for being here, and thank Senator Whitehouse for letting me jump ahead. It doesn't happen every day around here. I wanted to start with a question that I think, initially direct to Ms. Wilschke and Mr. Morton. One of the disincentives for recipients of SSI to work are asset limits, of course. The $2,000 asset limit today has a purchasing power of only $630, and it's a barrier that keeps people who want to work and save out of the labor market. I passed in 2014 the ABLE Act, and this was one way to ensure that SSI recipients can save for the future or prepare for emergencies without risking benefits. It allows an SSI recipient to save up to $100,000 in assets, making it possible to buy a house or an accessible vehicle or even to go to college. As of this March, about 171,000 of the over 4 million SSI recipients have opened an ABLE account and invested almost $2 billion. 171,000 is a big number, but it's only about 4% of the current SSI recipients. There are many policies we need to update to tear down the barriers to employment for people with disabilities, but we have a policy right now that can address the SSI asset limit that is being, of course, by virtue of those numbers I just recited, underutilized. So I'll start with maybe Mr. Morton and then Ms. Wilschke. What can SSI, or SSA, I should say, do to increase awareness of and participation in ABLE accounts to address the asset limit problem currently?
So with respect to ABLE accounts for SSI recipients and other disability beneficiaries, SSA does provide information on its website. It has helped us sponsor certain events. It's presented co-presentations with groups that advocate on behalf for ABLE accounts. But it is one, I mean, if you want to call it, an incentive or a feature for SSI recipients who want to work, it's one of many in conveying all the whole entire set of work incentives to recipients can be difficult. And I think that is something SSA has wrestled with over the years and continues to do so. And it is challenging. So potentially, increased efforts at awareness, would probably potentially help boost enrollment in ABLE accounts among SSI recipients. And as of January of this year, there were about 80,000 SSI recipients who had an ABLE account.
And Ms. Wilschke?
Thank you for the question, and I agree that ABLE accounts are really an important savings tool for people with disabilities. And I would agree with my colleague here that while it's not one of our programs, SSA does do a lot to make people aware of it through our websites, our publications. We partner with external organizations, and I'll mention that we are also embarking on a research project to, with some external organizations to look at ways to promote the take-up of ABLE accounts.
Well, I hope we can do a lot more because I don't think it's nearly enough. And I wanted to turn to Ms. Zuliger. You've been on the ground working with beneficiaries. Can SSA managers and field office personnel help increase awareness of and participation in ABLE accounts?
Absolutely. With correct funding and resources, we can definitely do that.
Thanks very much. I'll turn next to Dr. Gotlin. At the rate of the disability labor force participation has been increasing over the past 5 years, though there's still well below that of the non-disabled workforce. The Bureau of Labor Statistics reports that the May labor force participation rate for people with disabilities was 41.7%, close to an all-time high. Looking back 10 years, that participation rate has increased by over 30%. However, the demonstration projects designed to incentivize employment among SSI and DI recipients show only small increases in employment. And the major program to encourage employment, the so-called Ticket to Work program, has a very low participation rate. Most people with disabilities report that they want to work, of course. They also need to ensure that they have the health care and long-term care support that they need. Dr. Gottlieb, I wanted to ask you, what policies should be implemented to retain the increases in disability employment we've recently seen, and to even further increase the labor force participation rate for people with disabilities?
Thank you for that question. So this very much dovetails with your last question, actually, and also with the overarching theme of complexity that we're discussing today. And that is, not only are the work incentives complex within SSA, we have a complex system at the federal level. So an overarching policy recommendation is to make it easier for people with disabilities to access supports. And our prior work has identified 40 programs across 9 federal agencies that support people with disabilities. And there's limited coordination between those programs. So we have a recommendation, an outstanding priority recommendation to OMB to establish goals for national employment for people with disabilities. And we think that that could spur coordination across these programs and make them potentially easier to navigate and provide higher visibility for programs such as yours, such as the ABLE accounts, also the underutilized student earned income exclusion. That's one option. Another is early intervention. We have not done recent work on the demonstration projects. However, we've reviewed recent literature, and a lot of what is coming out of that literature is really indicating that the best time to target an individual is before they get on the rolls.
Thank you. Thanks very
Thank you.
Colleague,